I'm a fellowship-trained functional neurosurgeon, and what that means is I restore function, specifically focusing on things like Parkinson's and essential tremor. I've been doing deep brain stimulation, which has been around for ages, but I've been doing deep brain stimulation for over a decade here in the community. Focused ultrasound is something that many functional neurosurgeons are very interested in. When somebody has essential tremor, the time to undergo a procedure, such as MRI-guided focused ultrasound, would be when that tremor negatively impacts your quality of life. For some people, that's when the tremor is very mild. And other folks will say, you know, it's reached a point where I can't write, I can't sign my check, I can't eat, I can't feed myself, I can't drink a glass of wine. And so that continuum is different for every person. And that's what's so important, is doing a procedure that's right for you at the right time.
The tremors I first noticed just as far as eating, maybe trying to eat soup or trying to drink coffee with one hand, and then it's just, at first I thought it was, well, just maybe nerves or something, and then it just progressed to the point where it was affecting other parts of my life. I am a mechanical engineer. I work for a company that does medical devices. I'd say the hardest aspect is writing, and it's kind of weird. There's a bunch of little things like checking in hotels, you know, where you have to fill out the little card with your license and registration, and also having to just write checks and just little things like that. You know, they're small, but they're very impactful. A lot of the other medical treatments, a lot of the anti-seizure meds, some of the beta blockers, and between side effects and them just not working, it's kind of led me to this. My hope is that the tremors have a major reduction, and that it has minimal impact on my lifestyle.
Today was our 100th procedure, which is so exciting and rewarding for us. I think we are only the 6th site in the country to achieve 100. So essentially what we do is we focus anywhere between 800 to 1100 different ultrasound beams through the skull. As they pass through the brain, they don't damage the brain, but when they converge on a spot, they heat the brain up. That particular spot in the brain is a part of a circuit that controls tremor. And so when we burn that permanent hole in the brain, we disrupt that circuit and take somebody from an essential tremor to 70% or greater improvement in their tremor. It's different than other treatments. It's a very elegant way to treat tremor from a surgical perspective, because it does not require any implanted devices and it doesn't require any incisions. So it's safe in as much as folks who are older, folks who couldn't have surgery, folks who aren't interested in having surgery, brain surgery, or having implanted devices can now avail themselves of the accuracy that implanted brain devices allow, but without the incision and without the implant.
I'm feeling great. It's, you know, totally, there's no discomfort or anything. This is pretty new to me, since, you know, I just had the procedure within the last hour, so I'm sure it's going to be life-changing on many different levels. I mean, I'm just amazed at how much of an improvement it made in such a short period of time. Yesterday I said that I was having some problems texting people, and texting was a challenge, and when I was waiting to get released, I actually did text some people, and it was just amazing. It was probably about 5 times faster. I guess any advice I would give to someone that is thinking about this procedure, go to the Insight Tech website, go to the BCH website, do your research, have a consult visit with Dr. Beasley, and if you're a candidate, and I would say that, you know, it's well worth it to get it done.
Honestly, the most gratifying thing to me is that this is an immediate result. A patient will walk in one way with a tremor and walk out being able to sign their name. Their lives forever changed. And so for me, that's Incredibly gratifying, because much of what we do in surgery, it takes a while for people to heal from surgery, for you to see the result. That just warms everyone's heart, makes it worthwhile.